the idea for this panel came about as I was talking to employers in the community, trying to find some champions around this topic to see, like what kind of things are going on, what kind of information is out there. The most common response that I heard was, if you can find it, please let us know. And so I wanted to try to put together a panel of folks to address addiction, substance abuse in the workplace, and to also think about the role of employers in helping to address this issue. So our moderator today will be Michael Loy. He is the interim CEO of North Central Healthcare, and he will be introducing his panelists, and we will have a discussion to give some ideas about what are some potential solutions or ways to look at this in the workplace.
All right, good morning, everybody. As Corey mentioned, my name is Michael Loy, and I'm the interim CEO for North Central Healthcare and a proud community member here in Wausau. Today we are trying to connect our community, and specifically our businesses, to resources to help individuals who are struggling with the challenges of addiction in their everyday lives. We have a really big challenge, and it's going to take work to do something about it. It's a privilege for me to be a part of this day and uniting to think differently about addiction. I want to talk a little bit about our organization, North Central Healthcare, real briefly. North Central Healthcare's mission is Lincoln, Langlade, and Marathon counties partnering together to provide compassionate and specialized care for people with complex behavioral and skilled nursing needs. It's an organization I proudly am part of because of the amazing people who work there and the many wonderful things we do in the community every single day. Despite our best efforts and a vision of a world where lives are enriched and fulfilled because of the difference we make, we clearly do not and will not be able to do this alone to embrace these challenges and move our community forward. We need multiple supports to do that, and we hope to talk about some of those things today. Recovery happens much more often outside of our walls than within our walls. And one of the ways to increase continued recovery success is through stable employment and engaged workforce. The panel today, It's Your Business, Addressing Addiction in the Workplace, will help identify ways our business community can be a major support. Let me briefly introduce each of the panelists. First to my left is Devine Giese. Michelle is the president for Steph Industries. Steph Industries over the last 30 years has served more than 11,000 men and women in AODA recovery. Through their unique programs, they provide three critical elements for a solid foundation: employment, safe housing, and education. To the middle is Steve Schwartz. Steve is the president of Face It Together, an organization with an innovative, community-focused approach to addiction support. A key tenet of the Face It Together model is including businesses in the solution. This is done through broad-based workplace education and culture change focus, leading addiction sufferers and loved ones to get the help they need, contributing to positive business performance and personal well-being. Kierstin Justinger, on the end there. Kierstin is the Senior Manager of Workforce Strategy at the Hazelden Betty Ford Foundation. Hazelden is the largest recovery publishing house in the country, a fully accredited graduate school of addiction studies, an addiction research center, and is the nation's leading leader in advocacy and policy for treatment and recovery. In a few moments, I'll turn it over to the experts here and let them talk about the wonderful work that each of them do. And following the presentations, we will have a small Q&A session and invite the audience to ask any questions that you have. So as you listen, please think of the things that you want to ask as they talk about the unique work that they do. But before we turn it over, I just want to emphasize one last thing. The thing I hear most in my organization and from the business community is how are we going to find the workers we need to continue to deliver our services, but more importantly, the workers that we need to grow as a community. Employment is top of mind for businesses and people in our community. Today, our panel will try to help impart knowledge on how we can connect individuals struggling with addiction and recovery with the labor market that desperately needs their contributions. And with that, I'll turn the mic over to Kierstin.
Good morning. So a few weeks ago, I was in my office, and I actually didn't have a meeting, which was remarkable. And I received a phone call, and a person I had interviewed not long ago came by to visit and wanted to say hello. So I went out to the lobby, and I was very, very excited to see this person. They had interviewed for an HR professional position I had available, and they were awesome. They were super talented, and I really, really wanted to hire them. So I walk out to the lobby, and there she is standing, and she smiles at me, and I smile at her. And then I noticed that she had a Hazelden Betty Ford Foundation patient badge on. So she was a patient. So I looked at her, we shook hands, she looked me in the eye, and she said, one way or another, I was gonna get in here. And so we did, we laughed, but then immediately I just told her how proud I was of her to get the help that she deserves and that she needs. And I thanked her for coming to Hazelden Betty Ford Foundation, where truly she had a second chance, where miracles happen, where she could have a new life. So she told me she ended up finding a new position at a new organization, and she told me the week prior, that Monday when she went into work and shared with her boss that she needed help, that she needed to go to the Hazelden Betty Ford Foundation. She told her boss, I'm gonna give you 2 weeks though. I wanna wrap up all the loose ends and get the ducks in the row for what was yet to come. It's never over. And her boss said, no, nope, you're going today. And she told me that that was the most powerful thing that happened, because she knew deep down that if she would have waited those 2 weeks, that she wouldn't have received the treatment, the help that she needed. So I really thought about that, and I've thought about that since we had that conversation just around how would I or how would you respond to an employee if they came to you and they said, I need help, but don't worry, I'm gonna get a few more things done for you, right? Would you say, no, you're going today? So I know I will do that, and that was really, really impactful. And I hope all of us just take some time to reflect on that and think about how you would respond if someone came to you, one of your employees or someone that you know, that no, this is the most important thing right now and everything else can wait. So Michael introduced me already, and I appreciate that. My name is Kirsten Justinger, and I do work for the Hazelden Betty Ford Foundation. And I think I have a clicker here. Let me see if I can figure this out. Yes. So this is the get to know Kierstin slide really quickly, but the only thing I'm going to point out today is that I'm a born and raised cheesehead, and it's really nice to be in central Wisconsin in beautiful Wausau. But I've been in the human resource field for 20 years, and the first half of my career was spent primarily at Polaris Industries, another great Minnesota-based organization. And then I've had the honor of working with Hazelden Betty Ford Foundation for the last 9 years. And in my role, I'm in the human resource department, and my team consists of human resource business partners, and then we also head up our leadership development programs. And so our team is frontline with leaders and employees. We're working on recruitment, right? We're talking about how do we recruit talent and keep talent. We're working with engagement and navigating change. But the other part that we address within our workplace is performance issues, performance management, if there's employee relations, or if there's an investigation that needs to occur within the workplace. And typically, or frequently, there often is, underneath the surface, there's drugs and alcohol use or abuse that plays a role. So today what I'm going to talk about, and I think I probably have about 6 minutes to cover, is I'm going to talk about why it is so important to address these issues, and then as an employer, how do we address these and how do we manage them when they come to our attention. So from my perspective, when I think about an organization's role and from a human resource perspective, I really think about the care that we need to provide for our employees. And so there's so many reasons why this topic is so important, and there's so many reasons why we're here talking about it, but I'm really gonna be talking about it from an employer perspective. And so as an employer, it's important that our organization, your organization, is caring for employees so that they're well. Because we know that when their employees are well, the organization is well, our customers are well, and it's a great flywheel that we wanna keep rolling. But we know when there's substance abuse issues that employees aren't doing well. National Council on Alcohol and Drug Dependence identified these 4 impacts in the workplace, and you can see they are wide and deep, but it can be from productivity and absenteeism to the very worst case scenario as far as a fatal accident. There's other problems too, and as we heard earlier today from Julie and Jacob, you know, it may be the person directly impacted by drug and alcohol, but it could be a family member, a loved one who is living with someone, and how that's impacting them in the workplace. So alcoholism is prevalent in particular industries, but I really want to point out that no one is immune to it. Addiction does not discriminate. We know that there's other positions too. I would say maybe thrill-seeking type positions, you see more addiction as well. So emergency response, attorneys, pilots, and we actually have outreach managers within our Hazelden Betty Ford Foundation that are working with organizations. If you can imagine, if you're an emergency room physician, the decisions that you're having to make, they are life and death, and the impact if someone is under the influence. So we have outreach managers that are working with organizations on how do they have their employees, how do they get the treatment that they need, how do they then go back to work and be successful. And Joel Sycenas is here today from Hazelden Betty Ford Foundation, who's one of our outreach managers. So it's good to see you this morning, Joel. So I think I want to talk about what can you do. And as far as what you can do as far as an employer, there's a lot of layers here, and we could talk for hours just on this slide and all the slides, but really I think without question, it's really important as an employer that you have a place for your employees to go where you can refer people to professionals who can work in effective ways to address alcohol and drug problems. And so an employee assistance program is really an important aspect as far as a benefit that you're able to provide your employees. I really encourage you to partner that with a drug and alcohol-free workplace policy and then drug testing policy. So every state has their own, or maybe they don't have one, but yet there's a lot of guiding principles as far as what those statutes look like. But I definitely recommend that, and then really giving people an opportunity that if they come to you and ask for help, that you're not firing them, that you're helping them, that you're referring them to an employee assistance program, or again to professionals who can work with those employees who are asking for help. Or if it's reasonable suspicion, same situation, that we're helping those employees that they can get the treatment that they need. Health benefits, too, is a big deal. So I know when we were working with our health benefits plan, one of the things that we had to modify and we had to work through is that we needed to make sure that we had centers of excellence, treatment centers that we know talk about the outcomes and can share those outcomes. just like Dr. Ernst said, ask those questions about what are the outcomes. So we worked really hard to make sure that our health benefits included places like Hazelden, Betty Ford, and again, centers of excellence for people to receive the treatment that they need. Wellness programs, again, we've heard people talk often about wellness, and wellness programs, again, is a great platform to start talking about drug and alcohol use and abuse and the impacts it has on your body and your spirit and the workplace and you name it. And continuing that education and awareness so that we can talk to our managers and our supervisors about these topics and what do you do if someone comes to you and they're looking for help, or what do you do if you're seeing these signs. Just a really quick story, I was having lunch with one of our managers who oversees one of our corporate services, and I was asking her about her team dynamics and how are things going, and she actually brought up one particular person and said, you know, they're going really, really well, but I'm actually having some issues, some struggles with one of our employees on the team. They just seem to be having some production and quality issues, and just as far as getting along with some of the other team members. And for real, 2 days later, this employee called their manager and was under the influence and said, I need help. I need help. And I thought, good for you, for her to be able to address these issues, but yet at the same time create an atmosphere and a culture that he knew that he could come to her and say, I need help. What a testimony to her. And so he's getting that help that he needs now. The other thing just to think about is culture. As far as the culture, and if you're reflecting on your culture, think about where are important business decisions made, or what kind of traditions do you have within your organization. So are important decisions being made at happy hour? What do events look like at your organization, and then what messages is that sharing with employees as far as what's valued and what's acceptable? So on behalf of Hazelden Betty Ford Foundation, I really appreciate the opportunity. It's great to be here. And you can see we have our mission and vision up for you, and together we will overcome addiction. And thank you all for being here. Appreciate your time.
Thank you, Kierstin. Next, I want to introduce Steve Schwartz. Steve is president of Face It Together. Steve?
Thank you, Michael, and good morning, everybody. It's certainly an honor to be here and to share our perspectives on what we're trying to do to help what we call solve addiction. And addiction is a treatable chronic disease that is largely misunderstood. And when you don't understand what it is, certainly in the workplace, it's impossible to affect good change. So my angle with you this morning is going to be as a business person, bringing a business program to the fore. Now, Face It Together, just as a very brief introduction, is an organization that was founded in 2009 in Sioux Falls, South Dakota, by a gentleman who himself had been coincidentally a Hazelden alum, but a long-term recovery, a very wealthy individual who was quite frankly fed up with the system. And Doctor, you made a comment this morning about how the system is not built for success, and Kevin Kirby's recollection or observation was just that. So we looked around at what the models were that helped people who are in recovery or who suffer from the chronic disease of addiction, and we came up with a different spin, a community-based model that focused on peer recovery coaching and navigation services. Now, you heard a little bit about peer coaching earlier today, and you'll hear much more about it throughout this conference, but the notion is that how do you fund one of these entities? And the traditional funding for recovery community organizations in America is money that comes through the government, through SAMHSA funding. And we know, all of us who are reliant, or anybody who is reliant on government funding, that can be fickle. And so our program, this workplace initiative, was developed and invented, and I think I'm going in the right direction, there you go, to help really bring together the notion of real costs, the real costs of this disease, untreated addiction in the workplace, and then a program to address culture change. And Kierstin and I just met last evening. We did not rehearse this, but thankfully for me, I feel better that many of the tenets of our program were actually part of the tenets of the Hazelden sensibilities as well. So I share a couple of things with you now. On the slide is a calculator. An organization based out of the University of Chicago, NORC, a bunch of PhD researchers took the National Study on Drug Use and Health and Bureau of Labor Statistics data for the last 5 years and melded it into this real cost of substance abuse in the workplace. Don't know if you can see the URL at the bottom, but if you just go to NSC, nationalsafetycouncil.org, absolutely valid today's data. And what you need to do, frankly, is input 3 variables. The variable of where you are in America, statewide, the variable of what industry you're in, and then the variable of how many people work in your organization, and click Get My Report. What you're seeing on screen is a photo of a Wisconsin company in the construction industry with 250 employees. Not a named company, but just a profile. And you'll see that there's a cost to that organization of $117,000 a year. You see the breakdown in productivity and time and turnover and health claims. And what we're really trying to do is quantify the issue of untreated addiction in the workplace. And then once we understand that there's a real cost, a business leader has the option to make an investment in a program. And quite frankly, one of the programs available in this country is the one that we've developed. And again, I'm very honored to share it with you. So I start with this perspective. You're at work. Someone comes over to you and says, hey, I just want to let you know I'm going to be taking leave next month. I'm going to be out for an extended round of chemotherapy. What is the first human reaction to that individual by most of society? And I hope you get my point on this slide. It's hugs, it's compassion, it's casseroles, it's well wishes. Now let's take that same conversation and substitute addiction treatment for chemotherapy. My very scientific statement to you is not so much. Now, why is all of this the case? Because we have a society that doesn't truly understand what this disease is. We have a society that in large part doesn't even know that it's a chronic disease. In some places in this country, it's a moral failing, it's a choice, and that's just not the case. So what we did a number of years ago at Face It Together is we invented a program we call the Workplace Initiative. And the Workplace Initiative is specifically geared and tailored to workplaces, of course. But when somebody says to me, and many have, so what is this program? I am inspired by Walgreens. And I'm sure we all are consumers, and we see the intersection of happy and healthy. Well, about a month and a half ago, I had this epiphany that our program, even more complicated, is at the intersection of 4 established disciplines. You heard Kierstin talk about EAPs. Well, we are not an EAP, but we have a relationship to one, and we're an extension of one. We are not a benefit for all, because statistically, 10% of the population suffers from the disease of addiction, and so we're not a benefit to those who don't suffer, so it's a bit of that. A wellness program. When a person in the workplace can get treatment, get well, and enter into a continuum of care that matches the chronic disease nature of addiction, well, that's a wellness program. So our program attends to providing peer support for those folks. And then ultimately, and this is cold, hard business, and I hope no one takes offense to this, it's a risk management issue. Because if we go back to what Kierstin said, and again, I have the luxury of going after her, the costs of addiction that I show in the calculator, the statements that she showed in her slide with regard to absenteeism, presenteeism, turnover, healthcare claims, those are real, tangible costs. So a business leader has the opportunity to mitigate those costs in entering through some sort of a program that helps this addiction wellness concept. So very, very, very fancy graphics, the best I can do with embedded PowerPoint. But it really does help me make the point. The Workplace Initiative, by definition, is a program of broad-based education. led by the CEOs and the senior leaders of organizations. They get up on high in front of the organization and say, we are supporting people with this chronic disease the same way we would support you if you had diabetes, if you had COPD, if you had asthma, if you had chronic heart disease. Anything that is a chronic disease, we don't chastise you in the workplace if you have a low blood sugar reading. Why would we do so if you have a moment in your addiction? So education, modules and modules of awareness and teaching. That then creates and cascades to what I call a culture of empathy, a culture of understanding. I did not know this was a disease. Well, now I know, and now I have the potential to treat my colleagues in a better way. That leads then to the accessibility of help by those people who need the help because their environment is not toxic. This is a very stigmatized disease, as you all know. So nobody is raising their hand. And not that people are not entitled in any medical condition to privacy, but there is something about a chronic disease, one that needs constant attention, that you may want to tell people so that they can understand the symptoms of whatever your chronic state is. Addiction is no different. That then leads to wellness. The people who need help get the help. The employer policies, the employer environment is very progressive. It's very helpful. So as was the case of a moment ago, you get the sense that I go to my boss, I say I need help. They welcome it. As a matter of fact, they insist I do it now and not wait. Ultimately, the last cascading effect is that we have the opportunity to make more productive, more present, reduced health care claims, and as all of you know or may know, when companies offer health insurance to us as employees, that's based on a contract with the health care insurer. And the health care insurer is looking at claims data year over year over year. And the healthier organizations are, the lesser the premiums are. So we're looking at a cascading effect that is only a win for everybody. It's a win for the individual, it's a win for the company, and it's a win for the culture of the organization and its operating costs. If anybody is interested in talking about this, I suggest that we do it at that 4 o'clock or that 2:15 time. This is actually the schematic of what our program entails. The 4 phases are very, very detailed as it relates to understanding existing policies, understanding how HR documentation supports or doesn't support a recovery empathetic environment, helping tweak those, helping inform what would be the opportunity for somebody to get help consistent with their HR handbook. Then we look at setting up KPIs, key performance indicators, so that when we talk to a client company and say, what do you say success looks like in a year or in 2 years and 3 years, we have a common understanding of that. Earlier we heard about a 4-quadrant model for behavioral health and wellness, and I'm going to look forward to talking to you, Doctor, because our organization developed something called the Recovery Capital Index, which is a statistically validated objective measure of somebody's spiritual, cultural, social, physical capital. Comes from the writings of the grandfather of the recovery movement, William White. So that is something that we put through the rigors of academic validation, and it exists today, and we're using it, and I look forward to seeing how we can integrate our thoughts together. But measurement is important because I'm going to a business person and saying, I need you to make an investment. The investment has to then have a return. So measurements and outcomes are very, very important to the program. So in conclusion, this is what we're attempting to bring with this program. And whether it's our program or one that sounds like this or looks like this, these are, again, more serving suggestions for all of you to take a look at how do we create a recognition at the business level that there is a financial, monetary, cash cost associated with disease of untreated addiction in the workplace. How do we get people well? How do we create all sorts of positive effects and ultimately a measurable return on investment? That, by the way, mitigates the need for philanthropy. Because while there is lots of philanthropy, and there's the United Way, and there are many channels for charitable donations, there's a lot more need in America than there are channels. So we tend to be on a cycle, every 2 years, every 3 years, so they can spread the wealth and be helpful to many, many people. So this program is actually meant to try to mitigate and reduce those downturns in philanthropy funding by having a business essential program in place that just helps businesses stay healthy over time. So thank you on behalf of Face It Together and myself for this opportunity. Look forward to chatting later if anybody's interested in diving any deeper. Thank you and have a great conference.
Thank you, Steve. I want to introduce again Michelle Devine Giese, the president of Steph Industries. Michelle.
I'm impressed at how many people came out today to learn more about addiction and what you can do for your community. So thank you to everybody who took time out of their busy schedules to be here. Steph Industries is kind of unique. We are a social enterprise, so about 88% of our funding is from the sale of our services, which is packaging, assembly, collating, anything that needs hands. And what we do is take people new in recovery, teach them soft skills in a supportive environment, and put them to work so they can help gain self-esteem, work with others in recovery. We were kind of that peer support system before peer support was known what it is today, because we've been doing this for 35 years and over 11,000 people. How it all began was a Kimberly Clark executive who was in recovery, saw all these guys sitting around smoking cigarettes and playing cribbage, and said, "Why aren't these people working?" And they said, "Nobody will hire them. They have poor work histories. They have some criminal backgrounds. Nobody wants to hire them." He went to his boss at Kimberly Clark and said, "We have all these diapers that are going to landfill. That's not good for the environment. We've got all these guys who aren't working. Can I match the two up and try something unique?" And that's how we began. 8 employees 35 years ago, now over 11,000. We also operate in Milwaukee. We've been there for 19 years. We just moved to a brand new facility, which we're very excited about. We're doing great things down there, taking people from generations of poverty, generations of welfare systems, generations of addiction, and helping them start their world all over again. And the gratitude is just amazing. Whenever we need a little self-esteem or some boost for why we do what we do, we go down to our Milwaukee facility, and you can just feel the gratitude when you walk in. It's beautiful when somebody is that grateful for having a job that doesn't pay a lot. So the barriers, our people are generally people who have lost everything. Some of them have never had much, but some of them have had careers. Some of them have master's degrees. Some have bachelor's degrees, pilots, priests, you name it, they've been with us and generally have lost everything. They've lost family, they've lost their jobs, they've lost their houses, and they're ready to start over. And so we're that supportive environment that helps them do that. 70% of our people come through a referral. So they've gone to treatment somewhere, have spent generally 28 days, and are ready to take that next step back, and they come and work for us. In our Neenah facility, about 4 to 6 months, and in our Milwaukee facility, it's about a year. There's just less opportunity down there for moving on to the next thing. What we do from a job perspective is when you come in day one, we're going to teach you how to fill out the paperwork. We're not going to assume that you know how to fill it out, because if you're 45 years old and you don't know how many deductions you want to take, you might not ask somebody, you might just leave. So we assume we're going to be there to help you with every step of the process. We're going to teach you what it means to follow direction. What does individual accountability mean? What does it mean that the workday starts at 6? Does that mean you're in the break room? Does that mean you're punching the clock? What does it mean? If nobody's ever explained that to you, how do you know? If you've never been told what's appropriate language to use at work, how do you know? If you've always had issues with authority, if authority has been the parents who abused you or the employers who haven't spoken very nicely to you, how well do you take direction? We're going to speak nicely to you, we're going to support you, we're going to encourage you, and we're going to ask you to believe in our process, and we're going to help you along the way. We opened up a vocational learning center. We started to do career assessment and career building, and people were wondering, well, why don't you just have them go to the Fox Valley Technical College or another source that already does this? And after our first session, the teacher came to me and he said, you're doing exactly the right thing, because the things that your group is talking about, they would never share if they were mixed with regular population, because they're talking about, how do I deal with this felony? You know, this is the career I really want to go into, but I don't know if I can. I've got 4 OWIs. I don't know what kind of a career I can do. And if they were struggling with that in a regular mixed environment, they might not be willing to share because there's a lot of shame around that. And in our environment, they can share, they're not going to be judged, and everybody's going to be really supportive and encouraging, and we're going to find maybe an alternative. If you can't be an over-the-road truck driver, maybe you can get into logistics or warehousing. We're going to help get you in a direction that you're going to be successful in. A day at STEP is a little different than a normal day in the regular workforce. We start out with huddle, and you're meeting with your team leader, and they're going to tell you how you did the day before, because it's a real job. You have real expectations, and every hour, everybody knows how they did the previous hour, and we're going to celebrate. If you got 98% on a job, there's going to be applause. If you did 75% on a job, we're going to talk about it. What happened? Oh, we got a bunch of new people on the job, or maybe we could look at changing something. We're going to have a discussion. Nobody's getting in trouble. And then we're going to talk about good happenings. So people are celebrating 60 days, 90 days, sometimes a year. If you're celebrating a year at STEP, you're going to have to tell how you did it. And there's going to be a lot of people listening, because we learn from each other. Every month on the board, we have birthdays and sobriety anniversaries, so that you can congratulate people when their day is coming. We're going to read from a recovery-related book. There might be a little discussion about that, if it triggered anything for somebody positively or negatively. People can bring up a concern that they might have in their day. Maybe they have to go to court tomorrow, and they feel like running instead of going to court. Maybe they feel like calling in to court, Jesse. And that opens up the door for people to say, hey, I've been there. Show up for your court date. Do you need a ride? Do you need to go to a meeting tonight? They have payday pizza. Every other Thursday on payday, a bunch of people meet for pizza. They don't go to happy hour. There's not that kind of conversations happening. There's, do you want to go for a meeting? Do you want to go for coffee afterwards? Do you want to go to game night? It's a really different environment, and it's really cool. So our statistics, we provide real hours of training, we provide real paychecks, and we have real success. I hate having 100% up on our statistics, but that's what the data says. You know, people are building self-esteem, they're gaining confidence, they're feeling better about themselves, and that's what we're providing. And I always say, it's not us, it's not the staff that's doing it, it's the people that they're working with and working together and supporting each other. It's that peer-to-peer support. It's not what we do. We just provide the safe, supportive environment for them to do it in, and it's the magic of them supporting each other. So our leadership, we can speak from experience, because 21 years ago, I was sitting in that orientation because I was going to jail for an accident that I caused, and I needed a job that was going to be supportive, because I was working at JCPenney's, because I had lost everything, and people wanted me to go to Chi-Chi's for happy hour, and I really wanted to go to Chi-Chi's for happy hour. but I knew I couldn't. And so when I heard about Steph Industries, when I was in treatment, I thought, no way is there a place like this. And the next day I called and got an interview, and I've never left. I was only staying for 4 months, and that's 21 years ago. And that's how the staff is. Our vice president has been there for 19 years. Our operations manager in Milwaukee, 18 years. All of our leadership that's on the floor has been there. We've folded those diapers, we've stuffed those tampons in the box, we've done whatever the job is. We've struggled, we've supported each other, we've cried, we've seen people die, we've seen babies be born. We've been through it all, and we've been through it together. We have 4 recovery coaches on our staff. We have a recovery coach trainer on our staff. Many of us have taken life coaching classes together. It's a family. So we saw a gap. We needed some sober living for people. We just opened our 3rd sober living house in February. We have a women's house that can house 7 women, a men's house that can house 7 men, and our brand new house, which is the next step, kind of like a 3-quarter house, houses 6 men. They're all within walking distance to Step. As I said, we do packaging, assembly, collating. This is really just how we pay the bills. So if a company needs to outsource anything, we're the guys. And this is just a snapshot of 2016 at Steph Industries.
Thanks, Michelle. The one thing I want to just end on today is I've heard a lot in the lead up into our personal one-on-one conversations, our conversation as a group, and even in the presentations today around the word culture. And businesses are very interested in their cultures and trying to shape them and create a very positive culture to attract and retain the talent they need to be successful. And a lot of employers are still stuck in the past. They'll use things like when somebody has an addiction, they'll say, okay, we'll give you a last chance agreement, or we'll send you to EAP or go to HR. I really want to just get your perspective of how can employers really take it to the next level and create a culture that really is truly embracing addiction and recovery. And if we could start with you, Kirsten, please.
Okay. So I think for Hazelden Betty Ford Foundation, we're really fortunate because the culture is embedded because of what we do and what we believe in and what we value. So I've had quite a few conversations with Steve now and also with Michelle, but I think what Steve is really trying to provide for other organizations is actually the type of culture we have in regards to the openness and the willingness to help employees who do need help with drug and alcohol abuse. And so for us, I feel like we are really, really fortunate in that way. But we do continue to have conversations with our supervisors and our managers about how to address when we do see those issues in the workplace. And how do we make sure that we have policies and procedures that really do support what we believe in and what we value. And so to your point, as far as last chance, we don't use that terminology. We talk about the opportunity for someone to go and receive the help that they deserve. So I think that's all I would say about that, but we can definitely talk more at break and later on today.
Steve?
You know, in the working world, we have employment experiences, every one of us as employees, where if you define culture, a good culture, it centers around being real. The bosses I've had in my almost 40 years of working, the ones who were Teflon, the ones who were absolutely not caring, pretending to care, that degree of realism, that was just, you were turned off from day one. Those organizations, though, that embraced whatever was the cause, whatever was the concern. I mean, today, how many organizations give out Fitbits? Now, I would like to think that it's more than just trying to save on insurance premiums when you have lesser healthcare costs, but a culture of wellness where an organization genuinely and truly cares about their employees and it manifests. That's one example. So to me, the programs that we talk about are very much about leadership being resolved and recognizing that this is not a flash in the pan. This is not, today we talk a lot in America about the opiate crisis, and it is one, no mistake about it. But how many years ago was it about heroin? How many years ago was it about marijuana? What will be the next? So this is not the problem du jour. Addiction has been around since the dawn of creation. So an organization that embraces, recognizes this disease for what it is, helps support the people in the disease state, helps create an environment where people around them are empathetic and caring. I mean, that to me is the culture that we need to work towards, and it takes a ton of resolve by senior leadership and ownership of companies to make these claims and stand up tall and acknowledge the reality and try to help shape the hearts and minds of individuals.
Michelle?
When I speak to business leaders, I ask them, what is their norm at a Christmas party? What is their norm for outside activities? Do their picnics include alcohol? Do the activities that they help promote serve alcohol? Are they having family-friendly activities? How do they welcome back somebody who went to treatment? What kind of support systems do they offer to those people? Is there a designated safe person that people can talk to when they're struggling that's outside of HR? That's just a person to talk to that's not going to be documented. It's just going to be a conversation, somebody who's going to offer empathy and understanding. Do they have those? And I think the companies that do have a great culture for multiple reasons, and companies who don't need to take a look at that.
Thank you. Unfortunately, again, we're short of time today, but all three of the presenters will be available to answer your questions and dive down into the details now and throughout the day. So please stop and have those conversations. I want to thank all three of our panelists for their time and commitment to this conference. Thank you.